Hello, I'm Dr. Beth Colby, a psychiatrist from London. In this first video, I will be explaining some of the common mental health disorders and terminology in them. These will include some from the group of psychotic disorders, mood disorders, and what's called neurotic disorders, and I'll explain all those terms as well. What does psychosis mean? Well, I term psychosis with somebody having a sort of a break from reality and they don't know the difference between what's real and what's not real. So that's psychosis. People can suffer from schizophrenia, and this is a mental disorder where people are psychotic and they also have symptoms of delusions and hallucinations. Delusions are fixed false beliefs that are held even with evidence against them to the contrary, and these are out of keeping with somebody's religious, social or cultural background. Hallucinations can be in any sensory modality, so you can get auditory, which is hearing hallucinations, visual hallucinations, taste, touch and smell. And a hallucination is a false perception, so somebody experiences something but it doesn't come from the outside of their mind, so it's not in external reality. So for instance, a common one is auditory, hearing hallucinations, where somebody may hear a voice or voices with their ears and it appears to be outside their head and it is very real to them. They cannot distinguish that from a real voice that everybody else would be able to experience. So that's schizophrenia. There's delusional disorder as well. So people would suffer from a delusion but not have the hallucination or voices. That's part of one of my talks. And there's also a condition called schizoaffective disorder. Now, affective disorders are mood disorders, so affect how people feel, happy, sad, and I'll be discussing them next. But schizoaffective disorder is when people have symptoms of schizophrenia, so the hallucinations and delusions, and the mood disorders, so they could be manic, which is high, and I'll talk about that, or depressed, with the schizophrenic symptoms at the same time in the same episode of illness. And they could have schizophrenic with the manic symptoms together or a few days after each other, but very close in time together. Or they could have schizophrenic symptoms with depression. Or they could also have schizophrenia with mixed mood states, which are states where people have symptoms of mania and depression at the same time. So that's the schizoaffective disorder. Right, now let's go on to mood disorders. So mood disorders are also termed affective disorders. First of all, there's bipolar affective disorder. Now, bipolar means two poles, so people might be very high in mood or very low in mood. So what is mania? Mania is a state of mind where people feel extremely happy, uncontrollably excited, euphoric. They talk very fast, they act very fast. They may spend huge amounts of money on things that they wouldn't normally want or need and things they can't afford. They may be reckless sexually or using drugs and alcohol. They may have amazing schemes and out of character and have an overinflated sense of themselves. And these change from moment to moment. At the extreme end, they also may have some psychotic symptoms. What is hypomania? Hypomania is like mania and has similar symptoms but to a lesser degree. And then depression, there are 10 symptoms. I've done a talk on this before. But there are two mood disorders that are called persistent mood disorders. One of these is cyclothymia, where people's mood can be mildly elated or mildly depressed, but any of these times when people are like that, they're not as severe to warrant a diagnosis of either bipolar affective disorder or depression. There's also dysthymia, where people are chronically sad and unhappy. This again isn't severe enough to warrant a diagnosis of even mild depression. Going on to neurotic disorders now. They are initially thought to be of psychological origin, but as in all mental disorders, it's multifactorial. So let's look at some of the anxiety disorders. Now, anxiety is not a diagnosis in its own right, but it's a symptom of different disorders. And when people feel anxious, they feel tense, unable to relax. They may worry about impending doom or something bad going to happen. They may have physical symptoms like palpitations, dry mouth, tingling in their hands, pains in their stomach or muscles, or headaches, being unable to sleep. There's a whole list, and I've done a separate video on that I'm going to talk about. Agoraphobia, social phobia, panic disorder, generalised anxiety disorder, obsessive compulsive disorder, and post-traumatic stress disorder. Okay, agoraphobia actually are also scared of being in confined situations where they may not be able to exit. So in a busy shopping centre or a concert hall, something like that. And they feel enclosed and just need to get out. And this may lead to them staying at home and find it very, very difficult to get out of the house. And this is a really debilitating condition. Social phobia is when people find it hard to be in small groups of people. They may feel that people are looking at them and feel really embarrassed. They may feel that people know that they're anxious by how they look. They may feel that people are angry with them or upset with them. So so people tend to avoid these situations of small social groups. They may not know what to say and feel very uncomfortable. Panic disorder is where people get what we call panic attacks. What are these? Well, these are when people feel so anxious in certain situations and therefore become really anxious that it might happen again, so they avoid these situations. So that could be in a busy shopping place or on a bus, for instance. They'll feel suddenly really panicky with heart racing, feeling as though they're going to faint, lots of fear and worry, and they exit that area as soon as they can. And this leads to people avoiding those areas so that the fear that they'll have a panic attack may reduce. What's generalised anxiety disorder then, or GAD? People there feel anxious all the time, really. It's not related to any particular situation, and they can get the whole heap of physical and psychological symptoms of anxiety. Obsessive compulsive disorder. Obsessions are recurrent thoughts in somebody's head, leads to compulsions where people feel as though they have to do something. So an obsession might be, oh, my hands aren't clean, therefore I might get an illness or give it to my family and children. So therefore people will wash their hands. And then they may have the obsession again, oh, I might not have cleaned them properly, I better do it again. And they're compelled to do it. And once they've done it, the anxiety goes down, but then they have the thought again, so have to do it again. And that's really a debilitating illness as well. People may also have it to do with safety of themselves or their property. So they may have a thing where they're going to check the oven all the time to make sure the gas is off, or their house is locked. The last one is PTSD. PTSD, that's quite a common term. What does that mean? Well, it stands for post-traumatic stress disorder. So post is after, traumatic is after a really horrible thing happening. And this is something that's not of everyday occurrence. It could be if somebody's been sexually attacked. It could be somebody who's been in a car crash and been really worried for their lives. It could be somebody who's seen somebody stabbed or, on the battlefield. The symptoms that people might get in post-traumatic disorder are flashbacks. So flashbacks are where people relive that awful, awful experience as if they're there. So it's as if they can see and experience what's happening wherever they are around themselves, and they're experiencing the same anxiety, panic, emotions that they did then. And they may also have nightmares where they're reliving that event again and again. So I hope this has been helpful for you. So I've talked about diagnoses and terminology in common mental health problems, including the psychotic ones, the affective ones, which are the mood disorders, and also what we call the neurotic ones, which may have a psychological origin but do not have psychotic symptoms in them. Thank you for listening. Remember to like, subscribe and write comments.